All right, welcome everyone. It's nice to see so many faces here in the room. So I'm Sarah Brewer, I'm Director of our Education Program at Accords. I want to welcome you all today for our special seminar. For those of you who are not familiar, just a little bit about Accords as we dive in. So Accords is supported by the University of Colorado School of Medicine and the Children's Hospital Colorado. We are a unique one-stop shop for pragmatic research. With multidisciplinary collaborative research environment, strong methodological cores and programs, consultations and team building for grant proposals, mentorship, training, and support for junior faculty, and extensive educational opportunities, of which we consider our seminars one. So we are really excited to have this special seminar in partnership with our guest from PCORI today. Before I introduce our speaker and hand over the floor, just a couple of housekeeping items. We will be monitoring the chat throughout the presentation. So if you have comments, thoughts, questions, please feel free to use that if you are one of our virtual folks. For those of you in the room, we will also have time for Q&A at the end. So hold on to those thoughts and comments. We hope to have plenty of time for discussion. And then just for everybody, if you are here in the room, there are some evaluations on that back table, and we'll have an evaluation link for those of you who are online. We'd love to hear some of your feedback toward the end of our talk today. All right, let's dive in. For today's seminar, we are really excited to welcome our special guest, Flavia Bianchi from the Patient-Centered Outcomes Research Institute. She joined PCORI in 2023 as a program officer for the Science of Engagement team within the Public and Patient Engagement arm. She's previously worked in global health, specializing in pediatric HIV, working closely with patients, caregivers, and healthcare providers to develop and implement sustainable and patient-centered prevention, testing, and treatment interventions. She's born in Mexico City. She's fluent in Spanish, French, English, and Italian. So please join me in giving a warm welcome for Ms. Bianchi today as she presents Engagement by All, for All, Increasing Spanish-Speaking Partner Engagement in Research through Capacity Building. Welcome, Flavia.
Thank you so much. So, good afternoon, buenos días. Buenos días. Yo me llamo Flavia Bianchi Cifuentes. En la vida real soy Flavia Bianchi Cifuentes, pero en PCORI soy Flavia Bianchi. Así que si me buscan en PCORI, buscan Flavia Bianchi. Soy nacida en la Ciudad de México, de una madre mexicana y un padre italo-argentino. Y crecí hablando español en mi casa y estoy muy contenta de poder trabajar en español. Y por eso también estoy muy contenta de estar aquí con ustedes el día de hoy para hablar sobre este nuevo recurso que tenemos en PCORI, el Guía de Aprendizaje, Fundamentos de la Investigación en Español. Yo entiendo muy bien la necesidad de este recurso. Todos tenemos que participar en la investigación porque los resultados son para todos. La presentación de hoy va a ser en inglés, pero los materiales ya están vivos en español. So, hello. My name is Flavia Bianchi Cifuentes. I was saying that in real life, my name is Flavia Bianchi Cifuentes. At PCORI, it's Flavia Bianchi, but Bianchi Cifuentes makes for a very long email address. So it's Flavia Bianchi. I'm a program officer at PCORI on the Science of Engagement team, and I'm very happy to be here today. It's actually my first time in Colorado. I came to Denver to support 2 of the awards that I manage out of the university. The university is becoming known for being a bit of a hotbed for engagement research, and we're thrilled about that. So please keep it up, keep applying. Let me know if I can help you on your funding journey. I'm very grateful to be here to make this, to Accords, especially to be able to make this presentation work out today. So thank you very much for that. And today I will be talking a little bit about PCORI, about the Science of Engagement, the team, the initiative, the funding announcement. But I will be focusing on this wonderful new resource that we have to engage Spanish speakers, traditionally an underrepresented population, in research. It's the fundamentals, the research fundamentals training package in Español. And so here's a bit of an outline, but also I just also wanted to focus in on the meat of the presentation, which is to talk about how the process we went through to develop this resource, to really talk about or ensure quality so that users can really feel comfortable and trust this resource. So a little bit about the Patient-Centered Outcomes Research Institute, otherwise known as PCORI. PCORI's vision is to ensure that patients and the public have the information they can use to make decisions that reflect their desired health outcomes. PCORI supports, produces, promotes high integrity, evidence-based information that comes from research guided by patients, caregivers, and the broader healthcare community. Patients, caregivers, the community, their engagement is really at the center of everything that we do. In PCORI-funded research, patients and other stakeholders are equitable partners. So as opposed to being research participants or research subjects, PCORI is interested in the engagement of non-traditional stakeholders across the life cycle of a study. So from developing the question, developing the research plan, conducting the analysis, disseminating results. We want to see engagement that goes beyond input only. We really want to see partners embedded in the entire research life cycle. PCORI does require engagement for several reasons. The first one being that it makes research more patient-centered. It makes it more relevant and useful. Second, to build trust and a greater sense of legitimacy of research findings by patients and other partners. And third, and growing from the previous point, to encourage greater uptake and use of the research results. If you are looking for guidance on how to conduct engaged research, I will have a boatload of resources for you at the very end. There's a couple of resources in particular that I will draw your attention to. The first one is the Foundational Expectations that was recently updated, and then a document that I'm going to talk about a little bit later called Measuring What Matters. So just briefly on the science of engagement, for the past decade since its creation, as I was mentioning earlier, PCORI has required engagement from any award we make because it is the foundation of our work. And over the years, we have learned a lot about how to do engagement, but we realized that we had arrived to a point or at a point where we recognized that we needed more evidence on how to do engagement well. Especially among underrepresented populations, hence the Science of Engagement Initiative, which was launched in 2022. For the Science of Engagement, we wanted to be systematic about how we collect data and how we evaluate engagement. We wanted to move away from purely qualitative data, purely qualitative evaluations, to collecting more quantitative data, mixed methods, so that we can compare engagement strategies in a standardized and systematic way. And to do that, we wanted to support the development of measurement tools that allow us to collect these data. So here is a slide describing a little bit more the objectives of the Science of Engagement. And you can see a little bit the path from funding to impact. So our idea is that if we fund studies on the science of engagement, we can develop the PCOR community. If we do that, it hopefully leads to, the expectation is that it leads to better engagement. Better engagement will hopefully lead to more meaningful comparative effectiveness research, and that will hopefully lead to better practice and outcomes for the patient and the healthcare community. Here is our logic model. And it describes how we currently conceptualize engagement in research. So you see here how engagement in research occurs in the broader context that influence the conduct of and participation in engaged research and its outcomes. And so starting on the left, with engagement activities, the model speaks to the process of how researchers and partners work together throughout the research life cycle. The quality of engagement, that is the perceptions, assessments, and feelings of partners, will be influenced by engagement activities, and they will also then influence research outcomes, both near and long-term, as well as influence partner outcomes. A very valuable resource is Measuring What Matters, and it's linked to this theory of action that I showed you just now. It describes the logic model and further elaborates PCORI's current priorities for measuring engagement and research. What we did was identified and described 28 concepts about engagement and research, such as level of engagement, trust between partner and researchers, and post-engagement capacity and readiness for engagement. And then we organize them into the 5 domains that we saw previously: the engagement context, activities, quality, and outcomes. And we did this because we believe that by measuring and or describing these 28 concepts, it would support learning about engagement in health research. This is an excellent resource for anybody interested in engagement research. And if you are thinking about applying to SOE funding, it's basically required reading. So it is available online, and there's a link directly to it. So one last slide about the science of engagement and our 2 programmatic areas. The first is measuring engagement. We often refer to it as category 1. And that is to develop a set of reliable and valid measures that enable future comparative effectiveness research of engagement methods. And then our second priority, developing and testing engagement methods. This supports research projects that evaluate the impact of different engagement methods on key process and outcomes of engagement and research. I will link, there's links at the very end of the presentation to our PFA. We also do a lot of town halls throughout the year, and always welcome to reach out to us for more information, not just on the science of engagement, but any funding opportunity that we have. All right, research fundamentals. So what are these research fundamentals? This is a very comprehensive training package that helps people that are new to research understand the language and the logic of the health research process and be involved in patient-centered outcomes research. We wanted to make the research process, the research logic, the research language accessible to people outside of the world that we live in, that we work in, to really facilitate support, participation, and engagement in research, especially among underrepresented populations. This is a comprehensive package. It is free and available online 24/7. So if you can't sleep at 2 o'clock in the morning, please feel free to log in. It's very easy to understand. It's written in plain language. It does consist of multiple individual modules that you can view at any time at your own pace. And we have a navigator tool that lets you navigate, start and stop whenever you want. So when you do log on to sort of the landing page, you'll see the landing page. I think there's seven self-paced modules. There is an interactive PDF, and then there's also a static PDF as well. So here we go, the translation process. For several years, awardees, partners, and PCORI staff, this was very much driven by sort of internal advocacy as well. They've been asking for PCORI to translate this very valuable resource into Spanish because there was a clear need for it, but also because it spoke to PCORI's desire to reach a wider population, a bigger community. And again, because this population has traditionally been underrepresented in research. In 2023, finally, the work to translate the fundamentals began, and I'm thrilled to say that it is finally available. We started the translation team at PCORI with our subcontractors. We started with a very clear objective to communicate the information in a way that is easily understandable, that's functional, and it's culturally relevant. and to follow the process that ensures translation quality. So when thinking about who our audience was, who's our audience, we knew that it consisted of Spanish-speaking adults in the United States, representing different countries of origins and ethnicity, degrees of assimilation and acculturation, education levels, literacy, including health literacy, experience with the healthcare system in the US, and levels of knowledge and exposure about health research. There was also an expectation that the audience would vary in age, sex, gender identity, sexual orientation, and represent diverse families, for example, two parents, single parent homes, generational homes. So here's our process and a little bit of the timeline of when it all began almost a year ago. We worked very closely with a subcontractor who began with translating the materials, working with certified translators. This was step one. Prior to the translation, the subcontractor provided the translators with a document providing guidance about the translation called Translation Guidelines, and to also familiarize them to the language of Picori. Then the subcontractor and Picori, we identified terms and phrases for the technical expert panel, or TEP. So we worked with a technical expert panel that was outside of the subcontractor, outside of Picori, that would be able to review the translation and provide very valuable input. The TEP consisted of 3 individuals: a certified translator from Colombia, a former member of Picori's advisory board on patient engagement from Mexico, and a patient partner on one of our studies, the Prepare Asthma study from Puerto Rico. And so we all worked together over a period of a year to develop the translations. Yes, so the TEP members were instructed to review the text to ensure the translated text met specific objectives in the following areas. I'm gonna click all of them now. Here we go. Okay, so first, comprehension. In the areas of comprehension, the goal was to review and ensure the translated materials presented information in a way that people can understand the first time they read or hear it, was clear, concise, and used simple words in an active voice, and sounded natural, because the product is also a video that includes narration. Second, functionality. In the area of functionality, the goal was to ensure that the translated materials conveyed original concepts and message expressed in English as clearly and as correctly as possible. It valued the audience over terminology. That was very important, and we avoided a purely technical translation. There is some flexibility in the terms and phrases that we used, and also in the length of the Spanish translation. And we also considered the order of the words within a sentence for clarity. The Spanish translation, for example, did not have to follow necessarily the order of a sentence in English. And finally, cultural relevance. Here, the goal was to ensure that the translated material used language and examples that were familiar and considerate of the intended audience while avoiding stereotypes. And this included, for example, examples of activities and, for example, people's names. So we avoided John. John became Javier. So a few key decisions that were made along the way to really ensure a high quality product. The first, we have 3 of them. The first was focused around comprehension. Oh, my notes here. So the team made several key decisions here. The first was to have the translation be in an active voice, and we revised terms as well in favor of clear, concise, and simple terms. This was particularly important when introducing scientific terms, things like research methods, statistical terms, etc. in order to be culturally competent and be respectful of end users as well, we decided to use the formal you, usted. So we use usted rather than the informal you, tú. Across the training materials, we just thought that some users would react negatively with tú. So for example, a few examples here. The modules contain many headings and short titles that could be translated in slightly different ways. Picori and the subcontractor decided to use the infinitive verb in Spanish. So for example, in translating decide what to study or design a PCOR study, the team used decidir que investigar and diseñar un estudio de investigación PCOR. It's a lot. It's a lot. And then, for example, when we were revising the translation of Research Fundamentals Learning Package Navigator from a more literal translation, Navegador del Paquete de Aprendizaje Fundamentos de la Investigación, to the clearer translation, Guía de los Recursos de Aprendizaje Fundamentos de la Investigación. So just very aware, and there was a lot of back and forth, and it was really interesting as well because I speak a Mexican Spanish. We had a Spanish speaking team within Picori from one Mexican, one Peruvian, two Puerto Ricans, plus the TEP members, and we all speak Spanish, but we have different, sometimes words, slangs. And so it was a real opportunity for myself as a native Spanish speaker to learn how others understand Spanish when we're all talking about the same terms. And it made for some really, at times, funny conversations about the differences in the words that we use. So it was fun as well as work. So summary of key decisions 2. In the areas of functionality, we decided if, for example, figurative language was used in English, we used a translation that conveyed the message across and not simply translating a figure of speech that may not be clear in Spanish, sorry. So we avoided figures of speech. I have some examples. We added prepositions, articles, nouns, and pronouns as needed in Spanish as well for clarity, although they were often fine to leave out in English. We also revised the order of sentences so that in Spanish, for clarity, the subject is first, for example. In English, the reverse is often the case. So some examples. The video-based module included the term speak up. In the sentence, for example, the most important message I have for people is to speak up. The team revised the original, literal translation. El mensaje más importante que tengo para la gente es hablar. To, el mensaje más importante que tengo para la gente es que expresen sus opiniones y no se queden callados. Don't keep quiet. Speak up. So here in this case, we thought the revision is clear and it communicates the same message. Another example, we revised the original translation and added articles before the nouns for clarity and to improve comprehension of the material. While that is not necessarily something we do in English, it clarifies the translation in Spanish. So we revised, for example, developing research questions from the original translation, elaboración de preguntas de investigación, to el desarrollo de las preguntas de investigación. So we add that el and las, and a simpler translation for developing. So finally, a last round of key decisions that we made. In the area of cultural relevance, the team decided to use terms that were more likely to be understood by Latinos living in the US, which was another learning experience opportunity for me. For example, the team revised the original translation of give from, this is very Academia Real de España, but otorgan. I don't, in my life, have I ever used otorgan, to this very simple dan, to give, dan. For simplicity, comprehension, and to use a term that is more frequently used. The team revised the original translations, for example, limitations from conducting the study of, so originally it was limitaciones de la realización del estudio to las limitaciones de llevar al cabo el estudio. So for those, it's just the same message, but it's just in a very clean and easy way to understand. We also used names that were culturally congruent and resonated more for the audience. So for 5 characters in particular. So for example, Jerome became Javier. So it wasn't John, it was Jerome. Vicky became Valeria. Luis became Luisa. Amy became Amaya. And William became Guillermo. We also did, as you can see here, a swap of visual characters for a more diverse phenotype and face and different able-bodied representation. So here we have some examples and we have some more examples here. And I'm happy to say that PCORI actually decided to use these updates in the original English training materials. So you'll be seeing those as well. So we did rigorous testing as well, several rounds of testing. And here's just some feedback that we got from some of the end users about the translation of fundamentals. Yes, in one of the several rounds of testing that we did. Now, here we are, they're live. The materials are live. I was saying earlier in a meeting that when I was first developing these slides, I had a slide that said, coming soon, fall 2024. But I'm very happy to say that they are now live. Spanish is now live. Of course, English has been there online on PCORI. These will be linked there. So I'm just, I understand, as I said earlier in the introduction in Spanish, as someone who grew up speaking languages other than English and having parents who were not native English speakers, I am sort of a huge advocate for this kind of resource and increasing participation, increasing engagement from, people like us that have traditionally been left out of the research process. And what I mentioned in Spanish is that we need to all participate because the results at the end of the day are for all of us. So I was thrilled to be, this is actually the first time we've been presenting these results, not these results, rather these resources outside of PCORI. A lovely coincidence that, in fact, it's not a coincidence. It was very intentional for Happy Hispanic Heritage Month, by the way. So we were able to launch it in time for Hispanic Heritage Month. So wonderful timing, really. The presentation you'll receive has links to all sorts of resources for you, general resources around, building a team, engage, of course, the research fundamentals, the equity inclusion guidelines, and of course, foundational expectations, measuring what matters. I've also included some science of engagement. I had to plug it, of course. Resources there. We have some information on our upcoming next round of funding. And if you'd like to schedule a call with us, we are 2 program officers and an associate director on the team. We happily take office hours if you wanted to float some ideas by us. We can't tell you what to do, but we can provide feedback. And then again, more resources for you on how you can get in touch with us at PCORI online. You can schedule a call, not just with Science of Engagement, but with program officers across the organization. We also have a help desk. There is a human at the other end who will help you. And I think that is it for me today. Thank you.
Sure. Thank you so much. I am really excited about these resources because I work with lots of populations who speak languages other than English, and I know some of the folks in the room do too. I'm going to start with any questions we have here in the room. Pop back here. And when you introduce yourself, please use the mic so that our folks online can hear you, and introduce yourself before you ask your question.
Thank you. Good morning or afternoon. Monica Perez Yales. I'm associate professor here at Accords, and I am so enthusiastic to see these products. I completely agree as a native speaker from Colombia. I agree with the process. And I have a question. How do you, I noticed I mentioned that the emphasis was on Spanish use in this country. How do you approach Spanglish that we often use or communities may use? And for those of you who may not know, that's when we merge an English and a Spanish word in a lovely new word.
Yeah.
So I was curious for that aspect of it.
That's a really good point. We tried to avoid Spanglish, to be honest with you, as much as possible. And it was the TEP kept us in check. Sometimes I myself don't even realize that I use Spanglish. And so the TEP in particular kept us in check. I think what was particularly helpful as well is that we started with translators outside of PCORI, outside of the subcontractors. They did the first round of translation, and then we worked together with the TEP. But we really tried to avoid Spanglish because even in the case of Spanglish, not everybody understands the terms in quite the same way. So we recognized the Spanglish, but we avoided it. Yeah, but that's a good point.
Another question here in the room.
Hello, I'm Bethany Kwan. I'm a professor in emergency medicine and one of your two funded Science of Engagement awardees. Yep, Dr. Yada. So I was wondering, the concept of PCOR, patient-centered outcomes research, that concept is difficult to explain in English to researchers. How is that concept conveyed to community members in general and in Spanish in particular?
I mean, it was just a matter of breaking things down in a way that was very simple to understand without, we how can I say this? We didn't dumb anything down, so to speak. But we just broke it down as clearly as possible. And this resource in particular is for PCOR. And so we followed the guidelines or the fundamentals that were in English, because we really wanted, if someone spoke English, someone spoke not French, Spanish, and they looked at these two documents side by side, that they could really see, yes, these two are the same, just in a different language. So we really sat with every single word. Like, we really sat with every single word, the way things were structured together, we discussed how each of us understood the definitions, the terminology, the way things were being explained, and just meditated on every single word and how things were pulled together to be able to make sure that this was as easily understood by the readers without, with the idea that we felt like anybody could, the goal was that anybody could understand this, what we were trying to put, the materials that we were trying to put out there. I don't know if that helps. Yeah.
Thank you. All right.
Hi, my name is Lisa Camp. I'm an associate professor in pediatrics. I have an engagement award in which I propose to adapt some of the research fundamentals to use, and they told me you can't do that, they're proprietary, but they neglected to mention that they were being translated. So now I can use them. We haven't gotten to that.
Now you can use them. Yeah.
So I'm super excited. So thank you. As an aside, I talk around the translation of engagement all the time. So I'm curious to see what you did with that, but that's not my question. The process, you used a robust translation process. which we've tried to use in our research, but it's time consuming and somewhat expensive, and there doesn't seem to be any budget for that or recognition of that. And I don't know if the advocacy for this project and the knowledge that people gain through this project would help to change some of the funding landscape, to be able to incorporate those methods, into work.
Are you, so is the question sort of about what PCORI is thinking in general about
Yeah.
expanding funding that's a good question. I think I can speak for the science of engagement, sort of in general, or more specifically rather, and this I think applies to PCORI in general. I think, and I hope I'm answering your question. We recognize the investment that it takes to engage participants that are not necessarily English speakers, native English speakers, as one example of a underrepresented population. And within the science of engagement, we do consider that when we review budgets, and research plans, and we try to align sort of the population that you're working with, the activities that you're conducting, and the intended outcome. It does factor in. We do look at the budget, and we do look at the time, because again, we know that it's expensive and it's a time commitment. I think to answer your question, all I can say is that we do consider it. We have parameters within which we are working within the science of engagement. I'm not going to speak for my other colleagues, but I do know that across the board, engagement is it's the basis of everything we do. And so there is that consideration within the science of engagement, in particular, working within the parameters that we have in terms of, the funding ceiling. We do consider it. We do understand. There is sort of internal advocacy that's ongoing. But it is a consideration. Is that?
Yeah, I mean, I'm just happy to hear there's some consideration
Oh.
in internal advocacy. I mean, I think where I struggle and others struggle when we include populations who speak languages other than English is it's just really hard on the budget and the time, and you want to do it well. And it's often a very rigid, unflexible, like, sorry, the budget's this, like, make it work, which is often, you're sort of like, well, it's hard to make it work because it is expensive.
Yeah. And I understand. Having been on your side, for many, many years, I understand, sort of the potential frustrations, not to put any words in your mouth, that happens when dealing with sort of some of these sort of rigid parameters, but do note that we do consider it. And in fact, I would even say that in our reviews of research plans, if we think that an applicant is being too ambitious, given the budget, we may provide feedback that says reconsider. And it might be that the advice is, or the thinking is, perhaps start a little bit smaller for this round. But, again, we can't tell anyone what to do, but, which is something I hate saying. But we certainly do consider it when we review plans and budgets. And if we do see that we feel that if an applicant is being too ambitious, that will be feedback.
Thank you again. We have one question on chat. Anybody else in the room that I should? Okay, lots more questions after this one. So we have a question from one of our online attendees. Thank you for your really important presentation. Do you encounter culturally bound syndromes in the work that PCORI is funding? And if so, how do you incorporate and account for some of those in the engagement process?
Do we encounter what? I'm sorry?
Culturally bound syndromes?
I actually don't know what that would be. Could they give an example?
Yeah, Jose, if you would like to say a little more, either in the chat or come off mute, I believe we can hear you in the room if you want to explain a little more.
Hi, yeah, can you hear me?
Yeah.
Yeah, well, thank you again for the presentation. I think it's something that I've been pondering as we design our own research ideas here, but culturally balanced syndromes would be something like susto or empacho or nervio, something that's only known to a certain group of people that are bound within cultural norms.
Yes, now that you give an example, I am familiar with one of them. To be honest with you, it has not come up, at least not in the work that I have done. That's actually a really great question, and I will take it up with my colleagues within the rest of the sort of the engagement, patient and public engagement team. But I have personally have not in any of the awards that I have encountered or any of the work that I have supported, both within the science of engagement or outside of the science of engagement and of different funding initiatives. So unfortunately, I can't speak to that, but that's a great question. I'm actually going to bring that back with me.
Thank you so much for the talk. Hilary Lum, I'm in the Division of Geriatrics. I really appreciated how you walked us through your process of focusing on comprehension, functionality, and cultural relevance. So I think in your comments, I'm wondering if you could let us know if you considered any other domains than those three. That would be the first part. And then in particular with cultural relevance, I've been thinking about whether your technical expert panel or other parts of the process felt that it would be relevant to add content to the research fundamentals in this case, because it was culturally relevant. And it's that line of, well, then we're adding content. Is that okay? Is that beyond scope? And I could imagine that there could be a domain of values where it's just important to have values added to said intervention. And yet that's perhaps beyond the scope. So I think for us as researchers, we're often trying to navigate these choices.
Those were the three primary domains that we considered. Yes, so those we've primarily focused on those three primary domains. We do acknowledge that this is ongoing. This is a live product. We've just launched it. If there's any, and we're very open to feedback, and so and updating. And so if anyone reads this and sees, well, you missed this, we ask that they please let us know. In terms of your other question was around content. Did we add content? We did not add content. We really tried to align it with the English product as well. Yes, no, I can say that we didn't add content to this.
Maybe from I'm wondering if there were any hard decisions that had to be made that perhaps from a cultural relevance perspective, you would try to make a case for adding something so that it could be more understood or more relevant.
I mean, yeah, no, that's a good point. I think from a culturally relevance perspective, we really tried to work with what we had, with, in terms of that, almost like the translation from the English to the Spanish without having to add content. I don't remember sort of any major discussions, hard lines that we had to draw in the sand around, do we not add content to make this more culturally relevant. It would be interesting to see what kind of feedback we get, because it could very well be that we missed an opportunity somewhere along the line. But so far, and it's one of the, it is one of the reasons that we tested it among users, potential users. I think we went through 2 rounds of testing. to see if we missed anything. So far, I think nothing major has come up, but certainly if we do get feedback, we'll definitely consider if the need to add content. But I think really the goal was to try to stick to sort of align it with what the English materials had.
Thank you. We have another question over here, I think. Yeah.
Thank you, Flavia. Could you please clarify who is the audience for the training package? Is it researchers learning how to engage with community and patient partners, or the other way around?
A good question. So the intended audience are Spanish speakers living in US that would be considered research participants, research partners rather, not participants, excuse me, research partners in the research process. That's who our intended audience was. Yeah.
Another in the room, and then I've got one more on the chat.
Hi, my name is Anthony. I'm a post-bac researcher here. I just had a question when you were talking about like the cultural relevance. You said that in your group there was multiple translators from multiple or different country like of origins. And you said you had like trouble, translating with different vocabulary and different words that you're used to. I just wanted to know like how you overcame that and what you decided to like, what was the end product of like the certain words that were used. I know you mentioned that it was like vocabulary that like Latinos living in the US are used to, but I just wanted to like, can you elaborate a little bit more on how you decided what you chose?
No, and it was very much a process because the translators, what they often did was do a literal translation, and then it fell to us in the TEP to kind of work it out to make sure that we could understand it, that it could be understood by multiple like Spanish speakers, different types of Spanish speakers. And even Picori, when we translated Picori into Spanish, there was conversations around the exact word. And it was literally, together with the TEP, sending, back and forth. What do you think about this word? Does this make sense? And just offering, option 1, option 2, option 3, and just to see which one was most clear, which one was the easiest to understand, simple language. We really wanted people to sort of read it and hear it and be able to understand it in the first time that they read it, where, not avoiding someone having to go back and sort of sit with the text or replay the audio to try to make sense of what was being said. So it was like a very sort of organic, simple back and forth until we reached consensus, both the Picori staff and the TEP. And it was there's a lot of back and forth. Yeah.
The comment in the chat that I'm going to read for you. It's not really a question, but I think it's important to raise. So an excellent comment or question and argument I've frequently had about making the intense process of creating materials in Spanish. And Liz says people frequently think that Google Translate is enough. And so I'm curious if you want to comment further on sort of that default process for many folks.
Yes, it is not enough. Neither is DeepL, if you use DeepL. No, it's not enough. And sometimes I'm a native Spanish speaker. Sometimes I do actually have to look up a word on Google, and then I'll sit with it. I'm like, no, this is absolutely not what I meant to say, because it's usually very, very literal, and it doesn't account for sort of these nuances that you just won't get from Google. So yes, this is why we had many humans participating in this translation, experts in the field, the professional translators. We had these 3 members of the TEP, one who is a professional translator. We had a patient partner as well. And then we had us within Picori. This is the work that we do on a daily basis. We are also there were 5 of us, all native Spanish speakers, who could sort of speak to, sort of the science of it, but also the native Spanish speaker side of it. So yes, Google is not enough. Please do not rely on Google. You are going to end up confusing someone. It'll be like the most formal cannot make sense in a sentence that you'll ever come across. So yes, don't use Google. Please use humans.
I also have a question, as somebody who works with newcomer populations a lot, and I'm curious if PCORI is thinking about expanding the research fundamentals to additional languages in the future, having gone through this process once and sort of experienced that.
That is an excellent question. I think we understand the need for it certainly, and it certainly falls under what we would consider a priority. We are starting with Spanish. We started with Spanish because we felt like that would be a large population that we could potentially reach. This comes after some years of advocacy and requests. I think definitely if we find that there is the need, if applicants, research partners, researchers are asking for it, we take the message back to the decision makers and we advocate. But certainly, this is a great start, I think, for PCORI, and hopefully this sort of kicks off, like it gets the ball rolling in terms of translating for other languages. So if there is another language, please do let me know.
Excellent, thank you. I think we have time for one more question in the room if anyone has one. Okay. Oh, yeah.
Because as I mentioned, we'll be using, is there a feedback form, or how would we provide feedback from, we'll be using this with community members in 3 months if they say something isn't clear, or we really like this part, or whatever.
There should be, there is an opportunity to provide feedback. I think I did include that in the slides. But if I will find it and highlight it. But if I didn't include feedback for these particular set of slides because, or this research materials, because it is actually, we desperately do want, you may, if you feel comfortable, reach out to me. My email is among the slides here. Here we go. This is how you can reach me. This is my email address. And I will happily, but I will look that up because it should be in here. And I feel like now I need to make sure it stands out a little bit more. So thank you for that.
Well, thank you so much,
Thank
Flavia,
you.
for sharing these great new resources and for joining us today.
A pleasure. Thank you.
Yay.